I'm really excited to welcome Bradley Schwartz, L. Bradley Schwartz, to chat with me this morning. And many people know L. Bradley Schwartz as Brad. He is an attorney and the president and founder of Greater National Advocates. He's a fast-growing, I think, face of patient advocacy. He is a fierce supporter of patients and patient advocates. And I am so glad to have him as a friend, as a supporter of PULSE. He's a sponsor of this event, and he is really what we're about when it comes to patient advocacy. So welcome, Brad. Good morning.
Hello, good morning. Good morning, everybody. Great day yesterday.
I'm so glad you were part of that. And I want to, for people who don't know you, Brad, a lot of people do know you, but for those who don't, could you just explain a little bit about Greater National Advocates, also known as GNA?
Sure. GNA, or Greater National Advocates, is a nonprofit. It has a singular mission to spread the word about independent patient advocacy and to make independent patient advocacy services available to everyone. The goal is to really provide a free, quick, easy way for advocates to make their services known to the public. That includes the patients and families that are in need of advocacy services, the clinicians who are using the directory, social service organizations, and advocates like you and so many other people on the call that use the platform.
Thank you, Brett. And I've used it myself for when I look for somebody who does medical billing or insurance or things that we can't, we can't necessarily don't have an expertise. People have expertise on that. First, we look for people who have presented at PULSE programs, because we do 3 programs a month. So we're always looking for people who we're connected with, because at PULSE, we have the understanding of helping family members become patient advocates. And this is a great way to start, I believe, because they don't really even have to build a website. They could be part of GNA. Is that one of your goals, is to make it easy?
Oh, I mean, that's pretty much the whole point, you know. I didn't wake up one day and say, boy, I want to start a independent patient advocacy directory. I did it for a reason. I did it because it needed to be easy. It needed to be functional. There needed to be a great user experience, and it needed to have these searchable fields and categories so that you can find somebody by location, what their credentials are. You can search by BCPA, RNPA, MSW, whatever it is, area of expertise, and any personal information that the advocate wants the public to know about, to make that personal connection. So we're trying to give the patients and families everything that they need to make that quick connection with an advocate, and we're also trying to give the advocates everything they need to get started right away, real quick, and join the community.
Thank you, Brett. Could you give us a brief overview of what got you there to begin with? I mean, it's a personal story. Like I said yesterday, most of us have a personal story. What is your personal story, if you don't mind?
In essence, it's long, but I'm going to be real brief. I went to the emergency room back in 2004 with a headache. It was out of the ordinary for me. It was getting worse and worse. It was very unusual. I went to the hospital. I didn't get great care. I ended up getting misdiagnosed. It turned out that I had bacterial meningitis that evolved into sepsis and full-blown septic shock, and I ended up losing all of my limbs as a result of this inappropriate, uncoordinated care in the emergency room.
Brett, we know this is a tragic experience. It's not completely unusual. That's one of the reasons we do what we're doing. But as an advocate and through PULSE, we want people to walk away with, well, what could I have done? Not just a story. In every one of our programs and presentations, we like to hear, well, what could I have done to help this outcome be different? So what would be a tool that I can take away from your experience that would help me understand? Because I don't know if I could have helped you. I don't know. So explain to me how an advocate, family member, friend could have made the outcome different.
Well, I'm going to start in the reverse order. I'm going to talk about the family and the friends because they were there and I was there. And everybody has great intentions, but when you go to the emergency room, you're in that foreign environment. You as a patient, you lose all power, all sense of control. You enter into this state of like frozen paralysis. You're in this bed, you're in a gown, and according to everybody there who is in the ER running around, apparently doing their job, it doesn't matter who you are. They don't know who you are. So I had friends and family there, but nobody was really capable of pulling it all together. And I just got done saying I thought I would be able to, but when it's you, you freeze. So in my case, this is why I think a professional independent advocate would have made a difference. And it's specific to me. Somebody could have simply asked, because I went in and had my labs drawn right away, Eileen. They came back within 45 minutes. If somebody would have looked at them, they would have seen that I was going into septic shock. All my levels had warning levels, but nobody pulled the team together. So friends and family are great, but I started Greater National Advocates because they're not always enough. In my case, I believe that if I would have had somebody who had knowledge of how emergency rooms work, knowledge of what should happen during a handoff, knowledge to ask the question, hey, labs were taken 3, 4, 5, 6 hours ago. How come nothing was done? In that case, because when it comes to sepsis, and we're going to hear about this in a little while, timing is everything, and every minute counts, every second counts, and certainly every hour counts. Prompt administration of antibiotics would have halted and started to reverse the symptoms I was experiencing. That's how I believe, in my case, an advocate could have made a difference. Now, there's also ways that lay people and family members, and there's certainly things that I learned that I would impart upon anybody else who is in the emergency room. Number one, it is okay to, for example, ask the people who are working in the ER, who are you? What's your role? Are you an emergency room physician? Do you understand emergency medicine? I think the people who are a part of this symposium, a lot of them would be shocked to hear that just because you go to an emergency room does not mean that you're going to end up seeing an emergency room doctor or anybody that is even trained in emergency medicine. The state of our healthcare right now is such that when I went into the hospital, I had a staff that consisted of people who were substituting and moonlighting, part-time jobs. Nobody knew each other. Uncoordination, lack of coordination resulted in intubation and amputation. So,
and Brad, just on that subject, also, if you bring a child into the emergency room, to make sure that that's a pediatric nurse and doctor, because medication may be missed in an adult dose if they're not used to what a pediatric child might need instead of an adult. So that's a great point. I just want to ask you a question also. You're a white male, middle class male, I'll call, I'm not sure, but you also mentioned that there's some bias in there. How could that possibly be some bias in their thinking?
this whole bias thing works in many different ways. There's obviously age bias, gender bias, social bias. In my case, they believe that because I was a otherwise healthy 37-year-old white male with a headache, looking back in the chart, you could tell that they treated me as though maybe I had an acute hangover and I just needed to maybe sit in the room and get some fluid. So the bias, I think, impacted my care because I didn't look sick. I looked otherwise healthy. And in their mind, from a triage perspective, I wasn't at the top of the list. I wasn't a major concern. And I believe that all of that information and the attitude based on that bias was passed down from every member of the care team, especially during handoffs when the important information should be transferred but that information was, hey, this guy over here in room A, he's got a headache. He'll be okay. Leave him alone. So that happens. It's unfortunate. And but you nailed it, Eileen. As a white male, I mean, you're not gonna, usually hear somebody like me talking about, bias in an emergency room. But
And family members, I think one of the things that family and professional advocates can do is to ask, how are you getting your diagnosis?
I think that clinicians and medical care professionals need to understand that when a 37-year-old or anybody, for example, makes that decision, and in my case, it was Mother's Day. I mean, that just adds to it. To make the decision to go to the hospital because of a headache, you have to trust that patient that this is something different and out of the ordinary. You can't dismiss it. And so you're right. You do need people to stand up for you. But if all the people that come up to stand up for you show up 5 minutes before one nurse leaves and another nurse comes on and they're not there for this handoff, the information still doesn't get transferred and passed on. So
Right. So family members, you don't have to be a professional patient advocate.
No.
Caregivers could be, one of the things we tell people is when you go to the hospital or a doctor, make sure you have a notebook, a pen and paper, 2 pens in case one doesn't work, and make sure you're ready to take notes, everything that's said, everything that's done, because if somebody else steps in, they can help share that information. It's so important. Even your list of medications, because sometimes people in healthcare might think that you're on a new medication or you're drug seeker. This is another situation that comes up that we have to be careful. And obviously it sounds crazy, but the outcome, Brad, is the same. You have been injured, severely injured because of their mistakes. So we can't be saying that, well, maybe they thought something. Well, the fact is they were wrong and you suffered the consequences. I think the most unusual piece of what you are sharing, or part of what you're sharing to me, is that you survived and you're here to make changes and make a difference. And I am personally so grateful for that, because you are for 25 years, you're the person, I want to say the person who I've been looking for to make patient advocacy a name and make it important and matter. So for that, I personally appreciate you and the work that you're doing. With what you've experienced as a patient advocate, as an attorney, and a patient who's been harmed, and the president and founder of an organization promoting patient advocacy. In the next couple minutes, Brad, could you explain to us or share what you see as the landscape? I mean, that's the title of this symposium. What is the landscape of patient safety and patient advocacy in the future? How do you see patient safety and patient advocacy?
Well, I think that we're at a crossroads, and I know that can sound cliche, but I don't think that there's any doubt that as a profession, advocates and patient safety professionals are starting to make progress in terms of public awareness. That's obviously the number one mission of GNA, is to get the word out there, because I just believe that by waking up the nation to the life-saving benefits of advocacy, we're really going to be able to change things. And I mean, not only for the patients and families, but I think about all the nurses and the clinicians, and we all know this. It's no secret that people are leaving healthcare and they need a place to go. There are so many nurses who have, I don't want to repeat all this because we all know it, but the bottom line is there are experienced healthcare workers, clinicians, and individuals who have all of these skills, and they're starting to understand that independent patient advocacy is a way for people who want to help others to use those skills and apply them. That's the definition and the essence of advocacy. It's using the knowledge that you've gained and applying it to help other people who could benefit from that. And in the healthcare setting, that is where advocacy is going. I think that it's starting to expand to include younger new generation of advocates, new people who maybe haven't been clinicians for 30 plus years, the way that the profession has been for a little bit. We're starting to see a lot of people coming in who are survivors themselves, like me, not only of amputations, but rare disease. And I think that that experiential lived experience component is critical. And if you think about it, you know, somebody like me who's lived as an amputee for a number of years, I talk to other amputees all the time. I've been trained to do it. I've been trained as a mentors to provide peer support. I think that is a great avenue into advocacy for folks like me. And I also am starting to see that, well, I'll just say this. I know that the efforts and the outreach and the public awareness has been working, because if it hadn't been working, there wouldn't be interest of private equity, venture capitalist backed organizations trying to enter into the space. So I take that as a compliment that there are corporate ventures out there that really see this as the wave of the future. And I think from terms of the landscape, I think the challenge is going to be for advocates who are independent to remain truly independent, to understand that the biggest challenge that we have going forward is affordability and access to advocates. So based on everything I've said, based on where we've been, and based on this entry of money and profit, I do not want patient advocacy to start to mirror the healthcare system that we are trying to fix. I believe that by focusing on monetizing independent patient advocacy, we are detracting from our mission. I believe the money will come. I believe the funding will come. I believe all of those things are going to come. But if advocates are being asked and prompted to maybe increase their rates, it doesn't do us any justice as a profession. So the GNA concern and the GNA focus is going to be on increasing the availability of advocates and maintaining and ensuring that they are accessible and that people can afford to pay for them. And if they can't, we've got some stuff in the works to take care of that as well. But
Well, that's great information, Brad. And I'll tell you, we've never charged for our advocacy services. We don't charge it. We put it under training. It's all part of what we do. I've never been able to say, now that you're stressed in the healthcare system, now you got to pay us to help you. We look for the family members that are willing to help. We support the family. Our advocacy is family-centered patient advocacy. So we would work with the whole family. If your family called while you were in the hospital, we might be able to connect them with professionals who would be able to talk on the phone. They don't have to actually always be there. Ideally, we want to make sure that the patients and their family members are cared for. And if we can't help them because our focus is on safety, we know that we have GNA to call on, and other organizations that they can call on for support and advocates. So we're always looking to expand our network of patient advocates. We're glad that you're doing it. We don't have to do it. And I'm just happy to know that you're out there with this mission. The difference is, I think the big difference in what we do is you keep seeing the money coming, and I keep saying we've been looking for the money, and it's going to the hospitals and healthcare organizations, and they're forgetting that we need to work hand in hand. And the best way to work as partners with the healthcare system, of course, we're going to be partners. We all want what's best for the patient. So we need to be partners. We just don't see the funding coming in. That's the issue. We have to be able to prove that what we do works, and we're too busy helping people to worry about proving it. So let me ask you, again, the patient and families can elevate the concern. If they don't believe that they're getting the best care, they can say to the team in the emergency room or in the system, who else can I talk to? And I'm not feeling right about this. I know many years ago, I would have loved to have somebody like me to call when my son was not was not doing well. And I thought something was wrong, but who am I to question a doctor when they say he's fine and the outcome was he died? So what are there any other tips that we can give to patient advocates and caregivers, family members, and even patients on what they can do if they feel that something's not right?
I mean, always think that the key words are, I don't feel safe. And I think that if you can convey those words, all the warning signals and the red flags go off. And it's because of efforts like organizations like PULSE, for example, that we've gotten to the point where people actually recognize that if somebody uses those words and says, I don't feel safe, those are magic words, and they're going to result in action. And that is the intersection, Ilene, of patient safety and patient advocacy, because all of this information that you bring and your experience and the people that you bring together and your message and, taking charge, when you put that together and give that information to the advocates to carry into the institutions, that's a merging of two fields that have notoriously been separate and distinct, that are actually more intertwined now than they've ever been. So I appreciate you. The words that you said about me, I mean, I will gush all over you in terms of how much you and Pulse have meant to me. You've opened my eyes into the importance of intertwining not only our respective organizations, but building coalitions to get all of these organizations on board with nomenclature, messaging, and goals. So happy to be here. Was delighted yesterday. I thought it killed it on day one, and I'm excited for the rest of the program. So thank you. Thanks to everybody on the team, and thanks for allowing me to participate and for allowing GNA to sponsor this marquee event of Patient Safety Week.